Great. So looks like we have 36 folks on the webinar. It's fabulous. This is Thursday, the 24th of September. We are holding a stakeholder engagement meeting for day program services for HCBS waivers, adult day services. I think I should be the last person in line presented by. I'm just playing the piano here, and others are going to be talking hard policy and getting input. So let me just say that we are going to be using the chat to take comments and also the phone. And you can press *6 to unmute your phone to give a comment. And then please, when you're done, press *6 again to mute it. Can we move forward? And as always, the mission of the department, improving healthcare access and outcomes for the people we serve, while demonstrating sound stewardship of financial resources. Next slide, please. So today's purpose is to engage you stakeholders on adult day services, changes in those in response to COVID-19, and to provide clarity on previously issued guidance for ADS, adult day services, and to receive input, suggestions, and ideas for flexible service delivery, let me get a sip of coffee, including specialized ADS. Kira, anything, or Candace, you wanted to add to that before we move forward?
Yeah, I think that's great. We're just really hoping to engage folks today and get some feedback. So.
Very good. Next slide, please, Kelly. So the agenda, we're going to review Operational Memo 20091, and we will clarify previously issued guidance, and then we want to get your feedback on tiered adult day services structures and implementation thus far, and again, discuss flexible service delivery options for the specialized ADS and next steps. Next slide, please. Okay, so Kira and/or Candace.
Thanks, John. Welcome, everybody. This is Candace Bailey, and I am the Community Options Benefits Section Manager here at the department. And I'm going to run through, we're going to start off with going through the updated memo. So Operational Memo 20091 is really just an update to the one that we had released, which was 087, about the three-tier structure. And so as of effective September 14th, so a little over a week ago, almost 2 weeks ago now, I guess at this point, starting for the elderly, blind, and disabled, spinal cord injury, and community mental health supports waivers, we decided to go ahead and roll out to allow some flexibility during this pandemic period, with the hopes of seeing what works and what doesn't work and making it a long-term option for folks. So Tier 1, which is really the crux of the change, is going to be allowing these services, so adult day services, basic, to be provided in 15-minute units. There's the rate right there, which is $2.54 per unit. It's a limit of 12 units per day, or 3 hours. So anything over 3 hours would have to move into the next tier, which would be Tier 2. It can be provided virtually or in person. And this is really ideal for members who are vulnerable, or maybe they're just not ready to be in a group setting. They don't feel safe going into a group setting at this point in time. Or there are some folks that just really enjoy the telehealth option. And so this is an option for them to be able to continue to receive services in the way that best meets their needs and their preferences. This tier also waives many of the requirements of the facility-based settings, such as lockers, showers, meals, just based on the fact that these services can be provided in a variety of different settings. And so having those facility-based requirements just really didn't make sense for this tier level. Next slide, please. Okay, so Tier 2, really, we're calling it Tier 2, but this is really how services have been provided. So this is what was traditionally just known as the 1 unit of the 3 to 5 hours of services. The rate is the same, the $31.31, and it's in-person adult day services. This really allows for providers to do kind of like a 2 shifts, if you will, for day services. You still have to meet all of the same requirements, but it can actually be combined with Tier 1. So let's say, you have some virtual services that are offered throughout the day. You have a member that chooses to come in person, from 9 to noon, and then they see that there's an afternoon class, some sort of crafting class or an exercise class that's in the afternoon they really want to attend. They absolutely still can. And you would be able to bill for both of those. The next slide, please. And then again, there's Tier 3, and this is, again, how things were, but this was the 2 units of ADS. And so this is more than 5 hours. I want to point out that, and I really appreciate everybody pointing this out, during our last, I believe it was probably last week, 2 weeks ago, when we had our last, I don't even know what they're called, the Friday webinars is what we call them here, pointing out the discrepancies within the memo of 087 around how we said 6 or more hours. We did actually make that correction because you were correct. It is anything over 5 hours is what equals the 2 units of adult day services. So that is one of the main reasons for 087 now being 091 is because we wanted to make sure we made that correction to make that very clear. Again, this service, which is the Tier 3, must be provided in person. This is a regular full day of adult day services. So this is for those members that really thrive within the community, perhaps aren't as vulnerable, or just really, some members, the in-person activities are far more important to their mental health than actually the fear of getting sick, which is totally fine and something that each person gets to decide for themselves. This one, again, must meet all of the requirements that have always been there. However, it cannot be combined with Tier 1. The reason for that is this is a full day of services, and so there wouldn't be time to be able to bill for both. Next slide, please. Okay, so just to kind of reiterate and go through the intent and some of the highlights from 091. Again, it was really outlining the 3-tier structure and what it is. And the goal and the point of this is really members have a choice now to decide how they want to receive their services based on their own personal needs and preferences, which is huge. And this, what we heard loud and clear was there needed to be some more flexible options, and we're really hopeful that this is going to meet that need for flexibility. We wanted to make it clear that providers can actually provide, so this is basic, I need to be clear, we're talking basic adult day services. They can provide all 3 tiers. So you are not limited to just one. If you had 100 members that used to come to your facility and you have 50 of them that aren't ready to return, full day but maybe part day, you can offer a variety of different services and options for each of your members. We're really hoping that it is member specific and to make it much more person-centered. Also want to emphasize that Tier 3 cannot be combined with Tier 1 or 2. However, Tier 1 and 2 actually can occur on the same day, just not at the same time. And then to just remind everybody, if you were providing Tier 1 via telehealth, that you would need to enter 02, not just 2, but 02 in place of service, because that actually delineates and shows that it was delivered via telehealth. That is one of the billing requirements. We sent out a memo about that specific to telehealth, but just wanted to provide a reminder for everybody. And then the other key thing is that providers need to document the services that are rendered. So if you were providing half a day of services and then also some Zoom classes for folks, you need to document who you provided to and what that service actually entailed. Next slide, please. Okay, so service authorization changes. So with this change, there is going to be a required PAR change if you're going to add the Tier 1. So the prior authorization requests, also known as PARs, actually have to be updated to add the Tier 1 if the member prefers. So the case manager needs to actually have the conversation with the member to determine what their preference is, what their level of comfort is with returning to services, and talk through those options with them. They need to, each case manager will need a log note, so that's in the department prescribed case management system. They will enter in a log note that the results of that conversation, and if they want to add the Tier 1, how often, things like that. Obviously, they need to work with the provider to see what they can offer and what will be available to that individual. And then they will have to update the prior authorization request. So there are a maximum number of units allowed per tier, so keep that in mind. Please reference that memo. It does actually have it all outlined there. The new procedure code for Tier 1 is going to be S5100, and then the other procedure code for Tier 2 and 3 remain the same of S5105. Next slide, please. Okay, so moving on. So the tiered structure, the three-tiered structure, is specific for the three waivers that I was discussing. We have also adult day services that are available for the brain injury waiver, and however, because of the structure of the current service, we are going to offer a two-tiered service and not a three-tiered service. So here are the details on that. It's the same basic premise. This was effective September 14th. Tier 1 is 15-minute units. The rate is $6.28 per 15 minutes. This is actually limited to 8 units or 2 hours a day, and that is because anything above 2 hours is considered a full day. Again, this is going to be ideal for members that may be vulnerable or just aren't comfortable yet with being in a group setting, which is perfectly fine. And same waivers of some of the facility-based requirements. Next slide, please. And then here's an outline of Tier 2, which is services as usual. So this is how things have been structured previously, but we wanted to be sure to still offer this option and allow providers to open their doors and provide services for those members that really need to be in person and are really ready to be back in person. And so this is exactly how things were prior to the pandemic. And this is, the 2+ hours of service has to be in person, and it's a regular day of BI adult day services. And again, to be clear, it cannot be provided the same day as Tier 1. So Tier 1 and Tier 2 on the BI waiver may not be combined in the same day. Next slide, please. Okay. Same idea, just kind of going through some of the key highlights around the two-tier structure, which are very similar, almost identical to the three-tier structure, which is really ensuring that members have choice on how they receive their services. A member can actually receive both tiers, just not on the same day. But let's say there's one day that they want to do services virtually, and another day they want to go full, for the full day. That's absolutely allowed. It just can't occur on the same day. Again, if you're providing Tier 1 via telehealth, please be sure to enter the O2 place of service. And providers must document all services that are rendered. Next slide, please. Okay, and this is another highlight for the two-tier structure as far as the service authorization changes. The PARs, the prior authorization requests, again, have to be updated based on the member's preference. Case managers will need to have that conversation and log note any changes. The Tier 1 procedure code, again, is S5100. Tier 2 remains S5102. Next slide, please. Oh, our formatting got off when we uploaded it, apparently. Okay, again, just clarifying guidance for the adult days. Just want to make sure everybody understands that we appreciate you pointing out some of the discrepancies and things that were unclear in the original memo that we posted, which was 087. And so we want to make sure that everybody is clear that this is 2 days of adult day services is more than 5 hours of service. I want to pause here before I get into the next pieces of guidance and see if there are any questions around the memo itself that folks would like to ask.
Thanks, Candace. This is John Barry. So I believe that folks on the phone, you are not muted right now. Kelly, if that's incorrect, let me know. So if you want to make a comment, please do so. You have the chat and also the phone. Do we have any folks who would like to make a comment over the phone? If so, please let us know your name. Or obviously there is the chat. Very handy to type in a comment as well, or a question.
John, not hearing anybody on the phone. I'm happy
No.
to read through and answer a couple of chat box questions.
Okay. Very good. Thank you.
Great. Thank you, John. Okay, so I know Kira has been hard at work trying to answer several questions, but I'm going to try to pick out some that perhaps maybe she hasn't had a chance to get to. So I'm going to start with this one here with Prima 2 Adult Day Center. What if we pick up a member and he or she changes their mind and we have to go back for food delivery? Do we bill for travel time? The answer is no. So travel time is not permitted. It is not allowed to be billed specifically under adult day services. If you go to pick up a member, are you referencing for Tier 2 or Tier 3 or Tier 1? It would depend upon the scenario as far as whether or not you could bill at all, but you cannot bill for food delivery and you cannot bill for travel time, unfortunately. And then there's another question here. Can we get 5 days of full daycare and do telehealth on Saturdays additionally? So we don't actually have a limit to the number of days. Traditionally, adult day centers operate 5 days a week, so it's traditionally a Monday through Friday scenario. However, if we don't have limits on prohibiting the delivering of services on Saturdays. Let's see here. I see that a few people had trouble getting into the webinar. I also had a lot of trouble getting into the webinar, and our sincere apologies. Adobe, I don't think, enjoys my meetings in the mornings on Thursdays, since we all had this issue last week as well, or 2 weeks ago. But we might have to consider changing platforms to using Google, but we will see. Let's see here. We still have staff attempting to log in. Okay, our apologies for that. Yeah, Adobe's been difficult right now, and our sincere apologies for everybody's trouble. Any other questions specific about the memo 091 and the 3-tiered system?
It's Alec here. Can you guys hear me?
Yes.
Yes. Your name again, please go ahead.
It's Alec Kastner here from Alpine Adult Daycare.
Very good.
Just
Thank you.
a comment, really, rather than a question. Really appreciate the memo and the additional opportunities it gives us. However, it's kind of a little bit tough to choose because we need to, kind of know in advance who's going to be attending in what form to free up the Tier 1 units. I wonder if there was a different way to make it a little bit more flexible than having to go to case management every time something changes.
Okay. So I hear you. And what I'd like to do is I'd actually like to, if you don't mind, Alec, perhaps we can pause that question because I do want to touch on that a little bit later in the presentation.
Sure.
Looking for ideas and other ways that we can make improvements. So obviously we were trying to get something up and running quickly, knowing that it may not be the perfect solution. And so what we are really hoping to do at a little bit further along in this presentation is to think about the things that maybe aren't going to work well or are not currently working well that we can improve upon so that we can actually keep some of these flexibilities long term, so long after the pandemic. So I really appreciate that question, and if you don't mind, because we have a couple of slides on that, because I really want to make sure that we get everybody engaged for that. Great. Okay, so I see there's another question in here that asks if you give members a timed craft to do at home that we call and check on during the activities. Can you give? You may absolutely provide crafts and things for members to do at home. However, if you are not participating in for the duration of the time in providing services, you may not bill for that. So if you were calling and checking in and running through some of the steps for 15 minutes, you could bill 1 unit under the Tier 1 for 15 minutes. However, you could not bill for the duration. So you can't bill for services that members are doing independently. Okay. All right, so I'm going to move on just for the sake of time to make sure we get through some of this because I know that there are some questions around specialized adult day, and I really want to have enough time to have a really solid conversation around ongoing improvements that we could potentially make to make this a viable, sustainable service long term. And I also see that Kira's answered a lot of questions, so thank you and kudos to you, Kira. Okay, so one of the other pieces of guidance that we wanted to make sure that we discussed today is around the opening capacity. And I realize that the public health orders for the Safer at Home are broken down, especially the guidance is actually broken down into specific categories or settings, if you will. And in digging into this, we realized that, you know, our services and our providers, specifically for adult day services, don't fit neatly into any of the categories. And so we worked with Tri-County Health Department and our state partners at the Public Health Department to really see where it makes most sense for our providers to fall. And we all agreed that the limited healthcare setting is actually going to be the best place, because there are, you know, some actual health services, if you will, especially if you're specialized, that are provided to members during the time that they are on site. And so what this essentially means, and just confirms for everybody that may not have known, that facilities may open up day services at 50% capacity or up to 50 people, I believe it says, per room. So if you have questions, there is a link in this webinar that actually outlines the guidance that is published by the Department of Health, Public Health and Environment. They are the leading state agency for all these public health orders, and they actually have the authority over the public health orders. And so I highly, highly encourage you to, one, be checking their website frequently, but two, you know, grab this link and bookmark it so you can reference it frequently. I also want to make sure it's clear as far as guidance for everybody, activities such as workbooks or packets that are completed without the virtual presence, as I stated just a minute ago, or the assistance of a staff member actually cannot be billed for. So if you drop something off for members to do, that is not a billable activity. Next slide, please. Okay. Also would like to make sure that it is very clear that non-medical transportation cannot be billed for if adult day services is provided via telehealth. So you cannot bill transportation services if the member is not present in the vehicle. That is not allowed. And then for case managers, if a member is choosing to just do Tier 1 telehealth only and no longer has a need for the non-medical transportation service on their PAR, you should be discontinuing that. And another key thing, so we've been asked this several times, is delivering meals. Home delivered meals are not part of the adult day services. That is not a billable activity. Home delivered meals is actually a separate service that is available for members in transition for a year after their transition. So we highly encourage that if you are looking to be able to deliver a meal, perhaps you work into some activities that you could do with the member, and as part of that, when you go out to complete those activities with them, you also deliver a meal. Next slide, please. Okay, specialized. Good gracious. My sincere apologies for the formatting issues that occurred with uploading this webinar. This is not the first time I've seen this, but hopefully I think the one that is downloadable should be much clearer and easier to read. So again, my sincere apologies for this. Okay, so let's talk about specialized adult day services, as I know that there are a lot of questions that folks have right now around specialized adult day services. So this is available under the elderly, blind, and disabled, spinal cord injury, and community mental health waivers. So I also want to make sure that this is clear. So specialized adult day services are required to have a nurse on staff and present to provide additional nursing services. So we made this correction in the memo of 091 from 087 around specialized adult day and whether or not they could be continue to be provided in telehealth. So I want to make it clear that specialized adult day services may continue to be provided either in person or using telehealth during the public health emergency. So originally we had stated that it had to stop for telehealth. However, it was pointed out to us that one, it was a really quick stop, and then two, perhaps we needed to consider this a little bit better for the duration of the public health emergency. So I want to point out that clarification and that correction that we made. Also, the specialized adult day services does not include the three-tiered structure. This is a much more intensive service with additional nursing requirements and things like that. And so we did not initially include it in that structure for Tier 1 in the ongoing telehealth. Next slide, please. Okay. All right. So, but I do want to point out that we want to make sure that we talk about that and what that's going to look like. And that is going to be part of this discussion that we're going to have right now. So what we're looking for is feedback on the new tiered structure. So I'm going to list off a couple of questions, and I'm really hoping that we can get some great feedback either via the chat box or on the phone here. So a couple of questions I'll throw out there is, how has the tiered structure been working? I understand that we just rolled it out, so you haven't had a whole lot of time to really implement it. But thinking through your approaches and how it's working with you trying to get up and running with implementing this new tiered structure, I'd love to hear how it's going, both good things and bad things. What issues or obstacles are you seeing as a provider? Alika, I think you pointed out a great one as far as the shifting back and forth with asking for the constant PAR changes. What impact does this have on the quality of services provided? Do we feel like having this flexible option and the Tier 1 option is actually going to increase quality or decrease quality because there's a chance it might not be in person as much? And then, finally, the other question is, what changes still need to be made? So as we're looking at this long term and how we can sustain these choices and these options for members, what additional changes do we still need to be made, or do we still need to make for these services? Can you go to the next slide, please? Okay. So let's talk about the feedback for the current tiered structure, and then we'll move into specialized adult day services. What does everybody think? So I'm just going to jump in real quick to a couple of the chat questions since we started with the phone last time. Lori, do these new tiers apply to the participants in the DD waiver? No. So we are working on a tiered system for the IDD waivers separate from this. So they're structured and the services that are provided are different enough that we needed to have a slightly different approach. I see Second Home commented that transportation limitations are probably the biggest hurdle to overcome. Adds big labor costs and operating costs with no adjusted rates. We usually transport 3 or 4 people in a van and know we can only do 1 or 2. I hear you, and I understand that is a difficult thing, and I think part of the issue is we know that this virus is transmitted through the air, and having individuals in a small space together just really increases the risk and actually exposure and possibility of transmission. And so we really, really have to stick with the limited individuals within a van at this point in time so that we can keep members safe. One of the ideas that has come up is I do know that there are some adult day services that are actually operating in cohorts, a lot like schools, which is a really great idea. And as part of that cohort, we suggest kind of staggering times. If you're staggering times and, keeping staff individualized to each cohort, then you perhaps could stagger your transportation times as well, which would potentially free up staff a little bit more. But I hear you that it's not a perfect solution, and unfortunately at this point in time, just because of how incredibly easy it is for this virus to spread and how dangerous it is, we really, really have to keep some of those restrictions in place. Let's see here. John, do you want to see if anybody is on the phone that wants to talk?
Sure will. This is John Barry, and if anyone wants to make a comment by phone, would you please give us your name for the queue? I believe you are already unmuted. Would anyone like to make a comment by phone? Ask a question? Hearing none so far.
All right, I'll go back to the chat box
group today. Very good.
Yeah, we do. Thanks, John. Okay, so I do know there's another question here from Kim who asks, what if clients do not have access for telehealth, such as no internet or smartphone? but still want the services as a small group at client's residence? Is it tier 1 or tier 2? That's a really great question, Kim. Thank you very much, because we do realize that not every member has access to technology. And so that is part of the actual flexibility within tier 1, where you could go to the member's home, or, you know, I do know there was one particular provider that asked us about, there's a number of members that live in an apartment complex, and kind of having 3 or 4 of them in one person's apartment to provide services. And again, that would be accessible. So tier 1 can be provided in small groups in the member's home via telehealth. It can be provided out in the community, or say you have a number of 3 or 4 members that want to meet at a park. I don't know if a park's a good idea, but that's just what pops into my head. That is absolutely available. And again, it would be tier 1, so that those members that aren't comfortable with the full large group setting can also still receive services. Okay, so I'm going to go through a few more questions here, or comments in the chat box. Michelle King offered that flexibility of options for specialized programs would be important too. We can address the nursing component while being flexible as well, especially if given the option of continuing telehealth in the future. Some participants who attend specialized programs are interested in staying safe at home due to their comorbidities and need their community day program. Thank you, Michelle. I appreciate that. And I'm looking forward to kind of getting into the nitty-gritty there on how we could offer a flexible option for specialized adult day going forward as well, because I hear you that a number of those members are considerably vulnerable as well, and or just may not be ready to be back in a group setting, but need the services. Maria, could you tell us how many participants are in this webinar? There are still a lot of people who are trying to join and are not able to. Oh, Kira got that. Sorry, Kira. Thanks. There are 58 participants on the webinar. So Maria, I just want to point out that this webinar is actually being recorded and will be posted online as well. Just as a little piece of information, so you know, the PowerPoint and an actual recording will be posted for folks that were not able to get in. And again, my sincere apologies to folks for not being able to get into this super easily. I tried Internet Explorer a couple times and that didn't work. I tried Chrome a couple times, and I think around my 5th time on Chrome, it finally went through. So my sincere apologies, and like I said, we are going to take this back and kind of work on maybe changing platforms. I'm not sure. Any other thoughts or feedback on the structure set?
Hey, it's Alec here again, if I may.
Go ahead, Alec.
Can you guys? Yeah. Sorry, I didn't speak up when you were saying people on the phone, because I'm actually over computer audio, but
oh, okay.
I did want to comment how the tiered structure is working, at least for us overall.
Oh, I would appreciate that.
As I said initially, it's great to have the tier 1. It definitely helps, and every little bit helps these days. The tier 2 with the shift possibilities that you have mentioned, we can't really take advantage of that, because in our experience, if our participants come to the daycare, they want to stay all day. They don't want to be ferried back after lunch and another shift coming in. So the tier 2, while we always had that, we can't really use that to do shifts, even though that would be more profitable because you can charge for transportation as well. I think overall the biggest issue, and maybe I can explain it by likening us to a restaurant, because we are mainly based side. I know a lot of people on the IDD side are more in the community, but for us, we're essentially like a restaurant. And with the rules we have and we have to obey due to safety, at best, we can get 50% of our pre-COVID capacity into the daycare. I would believe that most of us, are running probably at 25 to maybe 40% if we're lucky. So that's the base side attendance. And along with that goes the loss in transportation, because you're not transporting as many people as before, nor can you due to restrictions. And that's all in the interest of safety, and we understand that. So now you add tier 1, and you will appreciate tier 1 only works for the people that are not in attendance, and only half of that, because you can only bill up to 3 hours a day. So if you had 50% of your people in the daycare every day, and you were actually able to keep the other half for 3 hours a day on the phone, you would get to 75% of what you had before. And again, this is at best. Obviously, we have probably the same problem as everybody else. Keeping people engaged virtually is a lot harder than keeping them engaged in person. And so, our usage of tier 1, I would think, is much lower than, the maximum 25% I just mentioned. It's probably closer to 5 to maybe 10%, if that, also depending on the day. So, all that is leading up to me saying, while we do appreciate everything that HICPAF has done, what is currently in place, even if it would be working to full capacity, which it does not, at least for us, is simply not enough to kind of get us over the hump long term and enable us to survive this pandemic. Because we're literally locking in losses every month in the 10,000s of dollars. So in terms of your last question there on the slide, what changes still need to be made, I would encourage ICPAF to seriously look again at the state option of 50% retainer payments to help, prop us up, the daycare providers, until such time as these capacity restrictions can be lifted again when the pandemic is hopefully more or less over, or we have a vaccine. Because the tools that you have introduced so far, while helpful, in my opinion, are just not simply enough to help us survive in the medium term while this pandemic is raging. Thank you.
I really appreciate you speaking up and being willing to share your experience and kind of walk through some of the scenarios with us. It is very helpful to hear how this is impacting each individual provider. And I hear you, this isn't a perfect solution, and it's not going to fix things, obviously. And so one of the suggestions that I heard you say is still going down the path of considering the 50% retainer payment option. And that's something that we have been looking into and haven't been able to receive a whole lot of traction yet, but I am happy to continue to pursue looking into that. But I would ask to see if anybody has any additional ideas on changes that might be helpful for increasing sustainability both during the pandemic and after the pandemic. One thought that I had, like, it was with the tier 1, perhaps, not everybody is engaging or enjoys the telehealth or virtual option, but maybe you could utilize the tier 1 to gather small groups, so 3 or 4 individuals, and you could still transport, them if you do 2 at a park, and you can still bill for the transportation for that, provide the services in person, and then return them back to their home. Your point is well made and understood that it is still a limited amount of time. It's only 3 hours versus the traditional, if they were staying all day, would be over 5. So I hear that, and I can certainly appreciate that. And, I just want to, echo Colin, and the things that he says frequently is, we sympathize with all of our providers, and, this is a tough time for everybody. And so if you have additional ideas or changes or suggestions, please be sure to speak up and give us those ideas. And I really appreciate you being willing to share with us. Let's see here. I'm going to go, unless anybody else wants to speak up via the phone or computer. As Luke nicely pointed out, that he's speaking over his computer audio, which works lovely, by the way. I can go back to the chat box here a little bit. So let's see here. Kira's answered a few of these questions. So I'm going to go into Annie asked the question, that she mentioned they serve the Chinese community and have had to make a shift with activities. For example, we are not playing mahjong anymore and shifted to bingo. We are constantly being asked when they can play that again. Do we think that there is a way to do these types of activities? So some activities, I think, as long as you are employing really good cleaning and infection control procedures, can work. I don't know how to play mahjong or what it entails, so I can't coherently offer you a really great suggestion on that. However, if you wanted to propose an idea around some cleaning and whether or not it would be acceptable for certain activities, please go ahead and send those ideas and how you would mitigate some of the risks with those activities to our inbox, which is the Healthcare Policy and Financing. So it's HCPF. Hopefully, Kira, somebody can type this into the chat box for people as well. But it's the HCPF_HCBS_questions@state.co.us. Thank you, Kira. And you can ask those specifics and how you would mitigate. What we do with those questions, just so you all know, is I actually often take them to our counterpart at the Public Health Department, the state agency, those that are responsible and in charge of the public health orders and surveying, obviously, and run past those mitigation strategies, run them past them to see if they agree or if they have any other suggestions of additional ways that you all can mitigate the spread. Or they may come back with their epidemiologist and say, actually, no, that's just too risky, and here's why. Which, as a provider, you want to know if you are thinking about allowing a really risky activity and probably not something you want to do. So if you can send those specifics to us, we would be happy to kind of run those past our partners at CDPHE to kind of see whether or not that would work or not as far as mitigation strategies. So there's another question here on second home. Is there any way to get a van approved for more clients? Separators or coding that kills COVID are options we are looking at. So unfortunately at this time that is not something that we have allowed. I'd be interested to hear more about the separators, but I think there's a lot going around about a variety of things that kill the virus that just really haven't been proven at this point in time or authorized by the CDC or anybody at this point. But if you have, I'd love to hear more about the separators. If second home, if you want to send us an email to that inbox, we would love to dive a little bit deeper on that with you. And then there's another one. Would HCPF consider utilizing the life skills training currently available under transition for individuals who utilize adult day? So unfortunately at this point in time, Maria, that service is actually specific to transitions, and we do not have the authority to expand that at this time. So that is not an option right now, but perhaps there could be some sort of hybrid option to where are there specific items within the life skills training that you are wishing could perhaps be added to the service definition for adult day. So maybe what we look at is seeing how we could expand perhaps some of those skills in that training and those options to the service of adult day services. If we're thinking long term here. Let's see here. What other? Okay, second home. We got people scared of groups, so park doesn't help that situation personally. Yeah, and unfortunately, I hear you. It's not a perfect solution for everybody. It's but it might work for a couple of groups maybe. Let's see here. What other questions do we have? Can you help us understand why you cannot get traction regarding the 50% retainer suggestion? Since those dollars were already in the members' authorized funding, why is the state making it so difficult to access those dollars? I want to be clear that the state isn't making it so difficult to access those dollars. Casey, the reality is that many day programs will likely go out of business. The state's retainer seems very short-sighted. There are JVC staff we can call. So I will tell you, you are always welcome to reach out to your legislators. And the Joint Budget Committee is responsible for the entire state's budget. And as you are all aware, the forecast and outlook is really dire. I think the last number I heard was a $4 billion shortfall next fiscal year. And they have to figure out a way to make up that money somehow. The 50% retainer suggestion is difficult to implement and to figure out because it wouldn't operate the same way that we operate things now. It couldn't run through the same payment mechanisms. It wouldn't have the same authorization technique because it would have to be completely and totally separate from everything with the waiver so that it is not accidentally reported to and paid by the federal government, and then we'd have a take back. So all of our systems are intertwined, and untangling that and figuring out how to authorize something that is large scale that would require huge system changes is difficult, quite frankly. And so it's not that anybody's trying to not make things work. It's just the way our system is built and the fact that these typically are federal programs. Offering a partial non-federal program for part of the time isn't as easy as it sounds because of the systems that we have in place. Additionally, it would have to get approval through the Joint Budget Committee and everything around that. So let's see here, it looks like Kira is responding to some. Okay, so Sammy is asking if the questions that folks are asking, if there's a repository. So traditionally what we do, Sammy, is we actually have an FAQ section on our COVID site, and hopefully Kira can post that link for you all too. So if we receive a question multiple times, we traditionally will either include it in that week's webinar that we host on Fridays for providers and case managers or the disability community. So we will include that information there or post an FAQ specific to that question. So traditionally, if we get one-off questions, we don't usually post those. However, if we get the same question, for example, around, can we, what is our categorization under the public health order for being able to reopen on the safer at home? It is the limited healthcare settings. That question actually will be posted to the FAQ so folks can see. So that's kind of how we traditionally operate, getting those posted. There's another question around retainer payments if a business has to shut down due to COVID for 14 days or some sort of relief. I know many. Okay, so this is a suggestion from Second Home about perhaps having retainer payments if, I would say, if there's not necessarily an outbreak, but some exposure, but when you have to shut down for quarantining. That's a great suggestion and something that I think is, as if we're looking into the 50% retainer payments as part of that, it's a great option to look into. So thank you for that, Second Home. Any other feedback on the current structure with the changes where we are allowing the Tier 1?
This is
How are
John.
you sharing the
Any
creative?
comments over the
It's
phone?
Alec here.
Sorry,
Alec, thank you. Anyone else for the
It's Alec
queue?
here, if I may.
Sure, go ahead, Alec.
Yeah, I just want to be on record that, I think despite everything I've said, I think the Tier 1 introduction of the 15-minute billing unit that, we had on the IDD side for a long time, in fact, that is the way of billing. I think that's useful long-term, not just, during the pandemic. And I think that's definitely something that should be kept. So I just want to make sure that I'm on record saying that. It doesn't necessarily solve the problems we're facing with right now, but generally I think that was definitely a step in the right direction. Thank you.
Wonderful. Thank you so much for that, Alec. It is great to hear that you think it would be a great option to keep long-term. We are hoping to be able to keep it long-term, but it's one of those things that we wanted to roll it out, and if it worked horribly and everybody hated it, there would be no point in keeping it long-term. But if you believe that it is and others believe it's a great option to keep long-term, and we're talking long-term, in my mind, that just means post-pandemic because, February feels like a million years ago to me and has to many other people at this point. So we're thinking post-pandemic. So I appreciate that, and I see Annie's in the chat box agreeing with that as well. So thank you very much. I want to read Sammy's question in the chat box. How are you sharing the creative solutions that are working so others can learn about new ways to deliver services? So Sammy, that's a great question. And traditionally, again, what we have done is we've actually shared those in our Friday webinars. but I think that is warranted with looking into perhaps further on additional ways that we could perhaps share that information. And so I don't have the answer for that right now, but perhaps we create a new section on that website for, innovative ways providers are implementing or providing services to members. I'm certainly open to that. And if folks think that would be a great use or a good resource for you all, then I'd be happy to get that started. So your guest has a question. Can our participants play board games such as Roomy Cube during in-person service? So that one is difficult from the standpoint of the proximity that would be required. And I think, if you can become creative in how you would play that board game to ensure that social distancing can remain or occur, perhaps one member is responsible for moving everybody's pieces on the board and others are distanced away, so they have to move everybody's piece, but they can all still play, or, reading out a question, things like that. That might be an option. And I think as long as you are able to ensure the social distancing and you come up with some creative solutions like that, it should be allowable. Okay, so I'm going to, I see that there's multiple people typing. I'll see if I can go through at least Casey's question here, maybe a couple others, and then we'll move on within the presentation. So Casey says, thanks for the clarification. The PASA certainly understand the state's financial challenges. For the day program situation is more dire. I absolutely understand that. Certainly the most dire, I would say. I guess the bottom line is that for most day programs, they're not going to be at risk for shutting down in the next few months. Or they are going to be. Sorry, I said not. I don't know why. Since our revenue is limited by state and federal funding resources, we have no other place to go for revenue. We need to run a sustainable service. Perhaps there needs to be some discussion about what the service model will look like in the future for our members so they can make life management decisions. I agree, and I think that's a really great point, Casey. And I think, business as usual for the day programs is what is making it so hard, right? This is the one service that I think is being hit so hard because the margins were so small anyways. Because it is state and federally funded, right? And so that's what we're hoping to be able to come up with additional solutions and ideas for helping things be sustainable. Retainer payments during the pandemic, I hear that, but that's not a long-term viable solution. And I worry that folks aren't going to want to go back to big, huge group settings in a facility full-time. And maybe they will, maybe I'm wrong, but we need to plan for that future just in case. And then let's see here. Sammy, guess there's actually a memo that's posted for NMT, and I don't have that off the top of my head, but I'm sure Kira can grab that memo and post it here for you. Sammy asked, I think being able to see that info on as needed, okay, or more likely as available would help without having to listen to the entire webinar. So I believe you're referencing the best practices or the innovative ideas that folks might come up with, and so I'm happy to, like I said, look into that and see if there's a way we could maybe have a section on our website that would offer up some of the suggestions and ideas that some other providers are implementing. I think that's a great idea. Anytime we can share ideas and innovative ways of thinking, everybody wins, and it really helps everybody. So that's a great idea. Okay, I'm going to move us along in our presentation here. So if you could go to the next slide, please. All right, specialized adult day services. So want to be clear that now we're talking about the specialized services, not just basic. And so we're wondering, again, could a similar tier approach or structure work for specialized adult day, such as a virtual current practice and small group? What if, for tier one, the tier one option for specialized, it would be that the provider would bill as a basic adult day provider instead of a specialized, and then they wouldn't have to provide those additional nursing services for tier one. And then again, what other long-term changes could improve the quality of the service, or are there any other suggestions or ideas that you all have for specialized? And I want to open it up to folks to either respond in the chat or via their computer or phone, if you would like.
This is John. Do we have any names for the queue over the phone? Anyone would like to make a comment? Candace, hearing none so far.
All right. So I'll go back to Michelle's comment that she had made earlier that she felt that a similar flexible approach would work well for specialized adult day as well. And what I'd really like to hear from from individuals is the option or the possibility, do we think that providing specialized services via telehealth would be viable and make sure that the service is provided in the way that it's supposed to, so that we're not going to be sacrificing any sort of quality of care or anything like that. Do we think that specialized could be provided that way? Or would it be a better or a different option for folks that specialized could provide Tier 1 and bill as basic adult day service? So what are folks' thoughts on that?
This is John.
I see several people are typing.
Anyone on the phone would like to say something?
Quiet crowd. But there are several people typing, so we'll go ahead and let them get their questions and their comments typed in. I see Kira is still helping out with some NNT questions. Thank you, Kira. I should have had some jokes ready for some of the downtime while we're waiting for people. But I don't, so that's unfortunate. Okay, Michelle King. Yes, we have nursing wellness check-ins and support that is going on a regular basis that we are continuing to provide. We would give vocal comments, but my microphone is not working. Oh, fair enough, Michelle. I appreciate that. So Michelle is saying that their agency currently is actually doing nursing wellness check-ins right now. And so perhaps you feel that that would work out well to continue. And Kira just posted the call-in option as well for folks. If you want to call in and mute your computer sound, sometimes I find that works better. I'm actually on the phone because speaking through my phone for Adobe usually works much better. And it looks like Cassandra is also providing some information around NMT. Okay, so Sammy Peterson. So if PASA's created learning pods for families to rotate through, you were saying that the only way they can bill for these services would be as virtual in Tier 1. I'm not sure I fully understand your question, but I'm saying that
I'm on the phone too, so I can add clarification if you need. Yeah,
that
so I'm just
great.
thinking in the ways that families are working with virtual school settings. A lot of them are grouping together and then rotating responsibility for managing that group from one family to the next. Is that an option that PASAs can do? Or is it, because I think the learning would be virtual, maybe, I don't know what's available, but just.
Are you talking specifically for adult day services?
Yeah, adult. Mm-hmm.
Yeah. So I think that would be an option, but again, it would absolutely be limited to Tier 1. So Tier 2 has to be the provider providing, and Tier 3 has to be the provider providing services in person at the facility. So, but it could be an option for Tier 1.
And if they had a staff person that floated with that pod from house to house, then that could be billed.
That would again would be Tier 1. That would again be Tier 1 because the in-person or in-home, not facility-based, is limited to the Tier 1 at this point in time.
Okay, gotcha.
But if that's something that you all think doesn't work well, then let me know. And we're talking both right now, what's working now, and what we would like to see long-term post-pandemic. So any ideas you have would be great.
I think that that's a viable solution since it's not that the site is not available, it's that the pandemic is limiting access to that site. So maybe relaxing the requirements around location
Gotcha.
would make that a viable option and have
For
it
tier
be billed
two?
at a higher tier. Yeah,
I see.
at the higher tier level. So if you've got a staff person on site, don't make the requirement be that it be on site at the business location.
Okay.
That also works for families. I am a family member, and so, while I support the retainer payments, my concern also is that, my child's not getting services, and yet I'm paying for those still, so out of my allocation annually. So that's another concern that I think you have for your customers. So I'll let someone else speak now. Thanks.
No, I appreciate you speaking up. Those are great ideas, and I like that suggestion, and so that's something that we can certainly take back to take a look at. All right.
I guess I have another thought too. It would be great to see, maybe a focus on what the learning is about. You could work on cooking skills, give learning pods to float from one house to the next that's working on cooking skills, or, household, like doing laundry skills, or I know those are kind of like homemaker skills, but I guess from a parent perspective, it would be neat to see what's being offered as a curriculum, maybe, of this is what your child will learn in this learning pod.
I think that's a great idea.
Yeah, a higher level of enrollment because there's a specific task that's being accomplished that the parent is wanting to see their young adult or their child learning, and you could group it by age, range, or even collaborate with the school districts on curriculum that they're working on, and this could be in support to that, similar to like tutoring, something along those lines. It wouldn't actually be that, but it could be marketed in that fashion.
So I think that sounds like a great innovative idea for providers to perhaps expand their Tier 1 options, and perhaps their clientele is offering up, as Sammy's suggesting, some pods and providing the curriculum or what will be, for that month, if you will, about the things that they're going to focus on that might entice families even more to participate in the Tier 1 option. So I think that's a really great innovative idea. I like that. Any other comments on the phone or computer?
Can you hear me?
I can.
Okay, it's Michelle Candace.
Oh, hey, Michelle. How are you?
Right. Good.
Oh, good. Great.
So, I couldn't find the conference line when I set up my computer this morning. For nursing needs, the flexibility for a day program to bill for 15-minute increments outside of, the programming hours. So we're providing the virtual programming right now under the public health order, but they're participating in that hour of programming, but then an additional time is being spent by our nurse going over medication issues or health issues that don't fit into that hour. So our nurse is spending additional time that isn't being paid for because it doesn't fit into the hour of programming. So as an organization, we're providing services that don't really fall into billable units because they don't fall into the programming time frame. So either we get them for billing time because we ask them to participate in the programming hour time slot so that we can bill, and they do, or they participate for programming and just fall short of hours because then they spend some time talking to the nurse about ongoing health concerns that they have, or medication issues that they have, or helping them navigate a doctor's appointment, or health insurance issues that they're having, or understanding what their insurance needs to be to get them to see the doctor that they want to see that they can't navigate on their own. So being able to bill for a 15-minute flexibility when the nurse is doing that on top of, sorry, I have a frog in my throat, on top of that
No worries.
hour of programming or 2 hours of programming or 3 hours of programming that they're putting in with us would make a difference for what our nurse is doing outside of what our actual programming staff are doing.
Okay. So then what I'm hearing is that you think allowing the specialized adult day, having a tier 1 option makes sense, but perhaps we need to put some parameters around that as far as that, you know, if you are going to provide tier 1 for specialized, there has to be some sort of nurse interaction as well
Yeah,
to justify the use for specialized.
Yeah, I mean, I think specialized, you have to have some parameters about, you know, one,
Yeah.
your nurse has to be involved in what you're doing. I mean, that's why we're specialized day programs.
Right.
So you have to stay true to why you're a specialized day program, because we're getting paid extra to do that. But two, you know, and what those parameters are. But as everybody else has already said, there has to be the built-in flexibility. Going and making a change to a PAR constantly eliminates that flexibility.
Yeah.
Because getting
And that
management agencies, as we all know, they're swamped, we're swamped. Getting that communication back and forth can be a challenge.
absolutely.
And then getting a hold of the client, and like it just takes time. So by the time you need that flexibility, a month has gone by and maybe you don't need it anymore.
Yeah. Thank you for your comments. I think that is certainly something that we can take back. And I see Alik had a comment too in the chat box that providing billing as a basic tier 1 seems like a good idea for them as a specialized. I think perhaps what the option could be is kind of more of a hybrid to where maybe we offer the tier 1 option for specialized adult day with the nursing requirements on it that, you know, we'll come up with some parameters there that, and if you aren't going to provide the nursing services, then you can bill for tier 1 under basic. So
Right.
maybe there's some sort of hybrid option that we could do with that. And then I hear the PAR requirements being difficult, and that's something that we can think about. We do actually, it is actually a federal requirement to have all services prior authorized. It's one of the things that we have to do, so we have to kind of think creatively on how we can do that in a way that would build in some flexibilities for providers and members.
I know. And I like the hybrid option of kind of like how the schools are doing.
Yep.
In person and tele being an option for people because in today's world, not everyone is ready to be back the way that some schools are doing remote versus in person, and I am seeing that as we're gearing up to open. Not everyone that we have is ready to be back. I do have a really high number of people who want to come back, shockingly, way more than I thought would be ready.
Interesting.
Yeah, it's been an interesting path as we gear up. I think just because they're isolated. So
yeah, I think you're right.
A hybrid option is maybe something that would work for people.
Okay. Well, thank you for your comments.
Yep, thank you.
This is John. I wonder if we have any other comments anyone wants to make by phone. Just want to point out, as you may have observed, it's certainly possible to make a more lengthy or, nuanced comment verbally than to type it out, and it allows for a back and forth. Any comments from the phone? I do see we have a number of things in the chat as well, which is great. Thanks.
Yeah. All right. Well, John, I'll read a couple of these from the chat box, and then we can kind of go forward from there. Okay, so it looks like I see Kira answered a few questions. So Alik also offered up or is asking, is there any news on adult day utilization? I would think that this is way below 50% since July 17th, which is when the retainer payments ended. Given the fact that they went away almost from one day to the next, yes, we know it was very sudden. And given the technical difficulties around the 50% state retainers, is there a way for a temporary and budget-neutral adult day rate increase to help providers survive? Would this be faster and easier than the 50%? So to answer your first question, I don't have utilization information off the top of my head. We can certainly look into that. The problem that we have with utilization data is lag billing, and so folks have 365 days to bill, and so we have no way of knowing how accurate it is, especially since July. And then the idea of a rate increase is really, really difficult given the budget climate. I hear you that looking at the change and the shift in utilization to keep it budget neutral, that is very difficult to do because it varies so much from client to client and provider to provider as far as the actual attendance and utilization rate. So I don't know that I would say that it's harder or easier than the 50% retainer payment, but I will say that any notion of a rate increase right now with the governor's office and the Joint Budget Committee is very difficult. But, I think your point being as far as looking at utilization and looking down that path is understood and certainly something we can look at. And then Maria has a comment that specialized adult day providers provide supports with activities of daily living in addition to providing opportunities for socialization, skills building, engagement with the community, and respite for families. I think the Tier 1 is currently missing many of the components of the service. I think the long-term solution needs to be focused on individualizing the services and bringing the services to consumers where they are in their home and based on individual need instead of bringing consumers to a group setting for an umbrella service. I think that's a great point, Maria, and something that we are hoping to achieve is, are we going to see a fundamental shift in how these services are delivered forever? I think that is a very high probability, and so we are hoping to be able to make some changes within the service definition and, the delivery of them so that we can stay with members' preferences and needs for these services. So I think that's a really great point. Second home states, any chance of retainer payments of a bit, okay, so we already talked about this one around the having to shut down the 10 to 14 days. As I stated, this was a good idea and a good suggestion for, if retainer payments were able to be at the 50%. Let's see here, Maria, current hours for in-home respite under EBD needs to be increased. Let's see here, LST needs to be offered at home. There could be a valid argument made that consumers stopping day program services is experiencing a change in life circumstances, which would qualify for LST under transitions. That's a little bit of a stretch for transition, but we could certainly look into that. And I don't actually think that there is a restriction on where LST services can be provided at this point in time. I'm sure Cassie will correct me if I'm wrong on that statement. And then I hear you, there needs to be more respite. Unfortunately, that would have a significant budget impact and not something that we can consider at this point in time. Okay, so I see more individuals are typing, but for the sake of the conversation and the presentation here, I want to go ahead and move on to the next slide, and we will certainly have some time for questions. Oh, we're already at next steps, never mind. I thought we had a whole other topic here. So the next steps, just as folks are typing, so please don't stop typing in your comments, but I'm just going to go ahead and read through these so you guys can know and anticipate what's coming. We are going to have another stakeholder meeting, much like this, that will be on October 8th from 9 to 11. There's information posted there. We will consider switching platforms because I did hear so many people had trouble getting in. What I'd like to know, and I'll reach out to several folks, is whether or not Google is a better platform for people or not. But if we do make that change, we will certainly update all of this information. But just so you know, there'll be another opportunity for additional comments, engagement, feedback on how things are working, what we want to see long term, all of that. Next slide, please. All right, questions. Okay, we just moved right through that. So I heard several suggestions around, maintaining the Tier 1 post-pandemic. That's almost like a no-brainer to folks. Like, yes, this should be an option for people going forward. And so I really appreciate that and hear that. I heard from folks that the parring is an issue, and if we could figure out a way to kind of make that a little bit more flexible for members, that would be ideal. Also, the transportation is a barrier. Unfortunately, just due to the risk, I think everybody's aware that that's not something that can quite go away, the limitations there at this point in time. I also heard that folks suggest having the Tier 1 option for Specialized Adult Day would be a good way to go, with maybe utilizing some sort of hybrid model. That if you don't want to provide the nursing services, you bill for basic, or you can provide Tier 1, but you have to provide in-person nursing as well on different days, or just something along those lines. But we can look at that, and we can certainly have some more information and suggestions out for the next stakeholder meeting for you all to react to. But just as a reminder that Specialized Adult Day providers are allowed to continue to provide services via telehealth at least through the end of the public health emergency. So we have, which is scheduled currently to end October 26th. I have no inkling ever right now as to what the administration will do, if they will extend it or not. But we will have something figured out before that end date. And it looks like there's questions about the webinar, and yes, it will be posted on the COVID page, which Kira just posted the link again, so thank you. And then Sammy wrote, look at what our non-disabled community businesses are doing to sustain their income. They're all moving online. Why can't the disability community do the same without penalty? And so I hear you, Sammy, that we are seeing a huge shift. And I never in a million years would have thought that I would have a second grader doing school online full time, like a college course almost. But it's happening, and it's real, and that's my house. And so it's something that we need to make sure that we offer up and figure out a way to have the same availability for members as well. Let's see here, some more comments coming in here. I think many of those ideas address some of the needs for providers, but I do not think they address the needs of consumers. So Maria, I would love to hear other suggestions and ideas. So, one of the key things and factors that we're looking for today, and anytime we do stakeholder engagement and feedback, is you guys are out there. You guys are providing the services. What other ideas do you have? Like, what other solutions can we come up with that will address the needs of consumers? I would love to hear them. That's the point of what we're hoping today, is to figure out what still needs to be tweaked and changed. So if you have ideas, please send them. You can send them to this inbox here. You can, type them in right now. Any ideas or suggestions, we would love, love, love to hear.
This is John. Any comments from the phone at this point? Or questions?
Yeah, it's Alec here. I'd like to comment.
Alec, please go ahead. Thanks.
Okay. I just want to instill, I guess, a sense of urgency. I think it's really good to have this discussion, and then I think all providers understand, given their own financial situation, what dire financial situation the state is in, and what the position of the Joint Budget Committee is. I would just encourage you and HCBUF with one thing. Traditionally, when HCBUF has felt that providers were threatened existentially and would not be able to continue, they've stepped up to the plate. We've seen that very recently in the middle of the pandemic, when the Denver minimum wage increase was happening. And I don't think there's any providers out there that would have survived this increase in Denver minimum wage without the rate increase that HCBUF pushed through with the Joint Budget Committee during the pandemic, and basically saved everybody in Denver that does home care. So I would argue that the situation with Adult Day is very similar. I don't think we can hang on much longer without, any additional action. And I don't know who needs to take action, if it's HCBUF, if that's something that the Joint Budget Committee needs to consider. But, think the message to whoever needs to be, we as adult daycare provider cannot hold on much longer. And it's simple to explain. We're really just like restaurants, and you cannot run a restaurant over an extended period of time, at 25, 30, 40% capacity. And so, I don't know if it's a rate increase or the retainer payments we talked about, but all we're asking for is that the money that is already in the system and currently not being utilized by us because utilization is low, that there be a way found to kind of channel that money back to us so we can survive this pandemic and then resume our operation when hopefully all this is over. So, that's kind of my 2 cents. There needs to be a sense of urgency because I don't think we can hold on much longer. Thank you.
Thank you, Alec. I appreciate you sharing again and also offering up that there is a real sense of urgency. I will tell you, the Denver minimum wage increase actually was a directive. It was a legislative action that directed the healthcare policy and financing to make that adjustment and that shift within the rate. That came directly from the Joint Budget Committee and approved by the General Assembly. And so any sort of increase like that would have to come directly from the Joint Budget Committee and approved by the General Assembly. That is not an action that HCLF can take on its own. We don't have the authority for that.
No, but you can recommend, and with Denver minimum wage, you recommend it and you voice your concern.
We
about
actually didn't make that recommendation. That came straight from the
costs.
So we actually didn't make that recommendation. That came from the Joint Budget Committee, and we're very limited in the recommendations and things that we can make. So we have quite a few limitations, and anything like that comes directly from the legislature. So I'm going to go ahead and read a couple of comments here that came in as well. Diane offered access to tools for online services and supports on education and how to navigate. So thank you. I think, that is something that we're struggling with and figuring out, how do members get access to tools for online services and supports. I do know that there have been a number of providers that actually have loaned out laptops and things like that. But that is not obviously super sustainable. So thank you for that offer and that suggestion there, and something that we do need to consider looking into. Shannon mentioned, I think it's been mentioned, but the ability to authorize more respite services, allow for flexibilities with LFT services and more one-on-one service options. I think if we can give caregivers and residential providers even a few hours of respite relief a week, that would make a huge impact. Thank you, Shannon. Yeah, I think respite is key, especially as everybody is home more. Folks need a break, and so I highly encourage, if there are members that are not at their capacity or don't have respite authorized on their PAR right now or their service plan, that you work directly with the case manager and the member and the family to see if we can't get that added to their service plan. Because it's just a really important part of caregiving. Any other questions, ideas, or thoughts? I really appreciate everybody that's been willing to share thus far. We certainly would not be able to do any of this without you guys and your suggestions. We need your input. It doesn't work otherwise. So if anybody has any other ideas or suggestions, again, go ahead and offer them up now via the phone, computer, or chat box, or you can email them to that inbox that's listed there. But we're very, very grateful for everybody that has offered up some ideas, and just all of you that are listening right now. It's really important, and we really appreciate it.
John, any comments from the phone?
All right, I don't hear any, but I do see one more person typing. Do we have Lynn last slide? I think it probably just says thank you. Yeah, thank you. Okay, so at this point, without seeing any other comments or ideas, or anybody else wanting or having the opportunity or wanting the opportunity to speak up via the phone, I think we can go ahead and close out a little bit early. I, again, want to just reiterate our sincere thanks for the engagement. We really appreciate, just the thoughtfulness and the willingness of everybody to come to the table to help us figure this out. This is something that obviously nobody has ever faced in our lifetime. I think that's like a new buzz phrase, right? But without amazing providers and advocates and case managers, Colorado would not be the great state that we are today. So we are very grateful. Please, 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 as you continue to think of ideas and thoughts or suggestions, please don't stop sending them to us. We love hearing from you. And, you guys are the ones on the front line. You're the ones that are providing the services, and so we need your input. We look forward to speaking with all of you again on October 8th. We actually do have our our regular Friday webinar tomorrow that is for providers. It's the TA session where we kind of go a little bit more in depth on new memos and things like that. So that is from 12 to 1. So if you have been tuning into those, I highly recommend going ahead and tuning in again. If you don't usually tune into those, check out our COVID page and maybe listen in. There's usually some really useful information. It's another opportunity to ask questions beyond just adult day services, but we do touch on that a lot as well. So thank you all. I hope you have a wonderful day and Thursday in this incredibly warm weather that we're having in September. And again, please reach out with any other ideas, thoughts, concerns, or anything that you might have. Thank you all. Take care.